welcome back. I'm your host, Michael Stamatinos of the Advancing Healthcare Innovation Show. And if you're new to us, we're just crazy passionate about healthcare innovation and adoption. And our aim is to bring real stories of innovation within healthcare, so real people that are truly innovating within our space. And look, we've got an action-packed year here with some amazing guests. We've got new content that's being planned, some incredible interviews. So if you haven't tuned in, make sure you look at some of the other interviews. I am just absolutely thrilled today to be bringing on a friend and someone that I think just embodies everything around healthcare innovation. So Dr. Seanna Thompson, who is the Senior Medical Director, Clinical Network Development for Mount Sinai Health System, has joined us. And I just want to say a few words before we dive into it. Dr. Thompson, is the way that I think about you is you're sort of a dual threat. You have someone that has an amazing clinical prowess, a tremendous background, a lot of history, and yet you look at the viewpoint of as entrepreneurial, and then also as someone who's a disruptor, who's not satisfied with the status quo. And I think that's something that I want other people to really understand and know about you. So welcome to the show.
Michael, thank you so much. As always, I love talking to you. I'm not sure where we're going to go here today, but I'm really excited to have a really robust round conversation. So let's go.
Let's dive into it. So your history is really rich, and I know you've spent some time at some pretty incredible organizations. So perhaps maybe we start out with just giving the audience a little bit of a background of, who you are, where you're from, where you're going, from a professional context. If you could maybe round that out, that'd be great.
Sure, I will definitely attempt to give you the cliff notes. I think where the bug started in terms of really diving into healthcare innovation, I was very lucky to have an opportunity to be at Mayo. And at the time, Mayo was doing telemedicine when it wasn't reimbursed, when it was a time that people didn't really understand. It wasn't sure it was a route wanted to go. So very, very, very early. And they developed the OB Nest program. And what the OB Nest program is a way for women who are pregnant to get their healthcare virtually. They were the first ones to do this. So they are the platform on which all these other companies have been able to develop and scale. And so that was the first time that I really gotta I guess dip my toe in to the advances of the telehealth world, and also the way that one can partner patient care and technology. Then from there, I had an opportunity to work with Lehigh Valley. Now, Lehigh Valley is typically, on the list of the 10 most wired hospitals. Very lucky to have experience with them. Mayo as well. And Lehigh, they have a very, I want to say, a very structured data analytics program. So when one thinks about, Epic is usually in the Midwest, and very well used in the Midwest. Lehigh, they are able to use the Epic product in a way that really gives superior care, makes it easier for the patients to use, easier for the providers to use. And so that opened my eyes to really how a digital tool can help the provider to help me give my patients superior care. Currently, I am with Mount Sinai, and the nice thing about, of course, being in New York, being with a really large healthcare organization, is there's lots of resources and lots of physician providers, entire healthcare organization that is thinking forward. So Mount Sinai is one of those organizations that has a Mount Sinai Innovative Partner wing. And so there's an avenue to bring in a lot of new ideas, startups, to help partner with Mount Sinai, because a lot of healthcare organizations have that data that everybody wants. And they help to partner to make whatever the healthcare innovation is, work for the organization, work for the patients, and also work for the startup. So that's been an interesting journey as well. That I think will continue to grow. I think I'll stop there.
Yeah, I was going to say, from an innovation standpoint, has the way that you've defined innovation changed, going from Mayo, then going to Lehigh, then now being at Mount Sinai? What's changed, if anything?
It's really interesting. I know we've had conversations about this. So, in terms of innovation, it's not weird and wacky. What do we have? And the previous CMO at Pfizer said, we have Star Wars medicine with Flintstone delivery, right? So we have amazing ways of, we have some precision medicine when it comes to cancer therapy. We have some AI, we have sprinklings of little things, but we can't get it to where it's needed. And so the Commonwealth Fund, August, so this month, we are now US is last among 11 wealthiest nations in terms of healthcare. So, how has my definition of innovation changed? Or maybe what type of innovation do I think that we need? I think I've been focusing more on that. We need better care delivery systems. We need, especially now with the pandemic, it's we can spend here forever, but it's unroofed so many different areas, so many different, unfortunately, vulnerabilities in our healthcare system. We can talk about getting the care to patients. We can also talk about the burned out physicians and nurses that are we have the great resignation, and this is affecting healthcare as well. People are burnt out. They are done. And so when I think about innovation, and if I focus on just getting the care to where it needs to be, it's all those stakeholders along the lines. And that's one of the many things that we need, and probably in a hurry.
Yeah, it sounds like, the human side of innovation is a really important one. As people, we are filled with emotions and desires, and just to sort of not take note of that, especially in the midst of crisis and chaos, is probably not a great thing. So one of the things that I think is important is to notate little wins. What, just over the course of the last 18 months, how strange things have been. Is there anything that you find notable as from a improvement of care delivery? Any stories that come to mind initially that you wouldn't mind sharing? Ones obviously that are non-confidential that you can share publicly.
Sure. I can go. I'll start a little general, and then I'll probably get general. But I think general, and I'm an OBGYN. I'm a women's health provider, so very excited about all the innovations in women's health. Maven, Oprah got involved, and that just took off that's a unicorn. Fantastic. And there's lots of different areas, from menopausal health to endometriosis to vaginitis. I don't know if this is too much for our guests, but all these different parts are really becoming important. And this is fantastic. So women's health, yay, huge win. And I've been invited to that table, which has been really exciting. So there's this one early startup, Palm Care, that is starting to go into the vaginitis space. There is Evie that's currently in that space, but there's a lot of disease out there, and there's poor access. So even as an OBGYN, when one of my patients has an issue that needs to be seen this moment, it's difficult. It is difficult for them to get an appointment with me. And I'm an OBGYN. I am all about innovation. I'm all about getting care at the time that it is needed. And it's nearly impossible. And in certain areas, you need to see, you need to look. We don't have innovation on how to evaluate certain areas without having that person in front of you. So very happy. Yes. So women's health, that's exciting. In terms of, I think when I think of personal journeys, we've talked a lot of we've worked together on a few different projects. I know you and Tangelo, working with Tangelo, which is food insecurity. So people need food, people need jobs, people need childcare. There's all these things that are kind of in the social determinants of health. However, there's barriers to implementing them. So
what have been some of the biggest barriers in terms of implementation, what that you've seen that kind of annoy you?
I have to say, to me, the biggest bugaboo is just reimbursement. So it's where the incentives are. So Mayo was very lucky back in the 2000s, early 2000s, to do what they did with technology and to develop these platforms really from Maven and all these other companies, because they had the money to do it. They didn't care about reimbursement. They weren't being reimbursed. But especially now with the pandemic, reimbursement is really important. And so whatever healthcare organization does, there has to be a return on investment. They can't necessarily just do it for the good of the people, for fun, because there's a lot of care that needs to get done right now, where we spend the most in healthcare as a nation, and we're last. And so when it comes to innovating and incorporating programs that we all agree, it makes a lot of sense to help get food to my patient's table that is not eating, that can't afford food, and food is medicine. However, to incorporate that program, the hospital can't fund all the cost. The healthcare insurer, they get more interested, but then we have to try to do pilots, of course, to prove what we already know. However, if there's not hefty reimbursement for that, it's very difficult for the healthcare organization to take that step. And so it's about finding willing partners to navigate, to build the case so that we can all.
How do you do that? How do you do that internally now? I mean, you obviously have a platform. How do you do that?
So it's a good question. I make a lot of friends. I make a lot of friends. And, as a physician, because I started to realize I love what I do, but like you said, it's about impact. So me and my patient one-on-one, that's wonderful. It's beautiful, makes me happy. However, I want to help the greater good. And so how do we do that? One has to partner with the insurers. One has to partner with all the stakeholders. One has to partner with patients, as well. There has to be that engagement to pull them in. And then you have to have, it's really important at the organization, there has to be a partner that is willing to move those barriers. And so I've been very lucky. I have a wonderful boss. I have wonderful people I work with at Mount Sinai. Innovation is top of mind. And in healthcare, the interesting thing is that the hard thing is that mission has to be ahead of the mighty dollar. And I know this is hard because you have to, but that's the one part that I think healthcare organizations are important to this puzzle. All the different stakeholders are important to this puzzle, because a lot of times they're able to go on mission. So how do I do this? I keep on pushing. We keep on, gathering whatever data we have to say that, what, if we decrease the hospitalization for this patient population, or if we decrease obesity for this patient population, we can in turn decrease the incidence of this disease and therefore save money. So we're able to do more of that. But it has been a process. I wish it was easy. I wish it was a flip of a, like we all agree, yeah, like give people some food. Food is medicine, but it's very difficult. And it would be faster, we'll eventually get there, but it'd be faster once the healthcare organizations say, you know what, there's reimbursement for these programs. Then there'll be a stampede. So I think the more we engage our partners, and I've been lucky and able to engage them in certain areas, but the more we engage our payers, the more we'll be able to move the needle.
Yeah, to me, it just sounds like, you've got your internal customers, your teammates at Sinai, and then you've got your partners, and you're treating your partners just as important as your internal team members. And I think you said that, healthcare is a team sport here. Has there been anything throughout this time that's just dramatically surprised you, that you think would be good to bring up?
Yes. And I think this is general. And so I think if I could, so medicine still, but up to this point, it has been rather provider organization specific, provider organization centric. We, some places say patient centric. However, I think with COVID, we really understood and listened to what patients needed. Patients are just like, I need a televisit. I can't make it. I need something else. I need an appointment at a different time. And people, so as a health organization, we're starting to realize, oh, I get this. I'm understanding that it really is important, and that I get better outcomes when I give the patient exactly what they need. And I guess another example that we're getting ourselves around, and this is another, and I know I'm probably making some people mad on the call, but when I talk about it being an organization being provider specific or organizational specific, things like, how do I say this? Just realizing now that a lot of care is not done in front of me. A lot of care is done out there. So the work that I do is maybe 20% of total health. And so we're starting to really think about, we have these buzzwords, care continuum, care coordination, because it's not like the patient comes in and then we give all the resources to like navigate. Yeah. No, the patient's at home. They don't need to come in anymore. But we have to adjust and really figure out, again, our Flintstone delivery, right? How do we deliver the care that's needed outside of these little walls? And I think another thing, and maybe possibly more so for New York than any other places because of the reimbursement models here, but some organizations before COVID, pre-COVID, it was all about special surgeries, like high reimbursement surgeries, and hospital admissions, right? That was the business model. That was it. That was it. And then you realize, oh, no one is coming in. And you know what? We canceled all the, not only some of the necessary surgeries, everybody was trying to be as prudent as possible, but the elective surgeries, our business model's shot. So I think, and we all know it, like we all know that that's not a model. And a lot of, I've been in the Midwest, I've been in other places. And so actually some of the tables turn in terms of outpatient making the same, if not more, bringing in more than inpatient. But some of that realization is coming to be reality, right? Like, oh, we really need to do something different, and we really have to care for our patients when they're not in front of us. And so
we've spoken about value-based care for the better part of a decade. Where do you see that going? Now that quote unquote, you mentioned it, look, no money, no mission. So you have to somehow continue to generate that revenue. And where do you see the value-based model going? How is Sinai sort of innovating in those areas, potentially maybe even doing more population health, maybe going at risk, doing more risk-based type of contracting, to the degree that you're able to share? Where do you see that heading?
So I have to partition this, and I won't talk about Sinai in general. I'll talk about New York because everyone kind of does the same. So where is value-based care? So it's interesting, right? We have Kaiser. I can talk about Kaiser all I want because I'm not at Kaiser. but where's Kaiser? They're the ones who did value-based care like a long time ago. Like they've organized all these models and they've made it, cost effective. And it's there. Here's value. Here's true population health. And the rest of us are kind of thinking about it. Mayo is all about healthcare delivery, all about and they're very reliable. They've been #1 on the U.S. News and World Report for a long time, and it's because of the way that they treat their populations. It's all organized, and it's a couple of different things. Value-based care is cheaper. So even if those incentives aren't readily there, but granted, in Kaiser and in Minnesota, most of the West Coast, it is, because they have those contracts. They've maximized those contracts because they know how to do it. It becomes very clear. It's like no other way to do it. I don't want to do fee for service. That's silly, So I feel that the momentum is growing. We're still talking about it. However, from the provider incentive, a lot of provider pay, and different organizations can do it differently. They're talking total cost of care. So the primary care doc will be reimbursed looking at how the total cost of their patient's care is. So that's one way to feed it in. And then you said it. It's really getting to the table and talking with the insurers about risk-based, models. The hard thing is that, and I can see this from the organization standpoint, if you haven't put all the models in to make sure that you can reap all the benefits, hard to dip your toe in. And New York has a lot of people, millions upon millions of people. So fee for service, it really feeds the bottom line. However, I do feel that now the consumer is pushing. The consumer's tired, and especially with COVID, they really got more tired. And also we have price transparency. So when you start seeing why does it cost how much there when it costs over there, and actually people are going to say, you know what, I'm going to go fly to Idaho because it's far cheaper than doing a case here. What am I getting? So that's going to push the conversation further along. So I wish we were further in the value-based, care models. I do think we'll get there because we have to. Why? Why do we have to? US is last. I think I'll keep coming back to this. We're last in healthcare and we spend the most. So, we have to do something. I'm a mom of 3 children. God forbid my child was last in any subject, but you know what? What are we going to do? We're going to spend extra time. We're going to create some models because you only get the outcomes that your system creates. So we're going to have to create a new system. So that's
constant leadership, though. It sounds like you're at a place now where you have excellent leadership, support. What about the innovator that's maybe they're an organization that doesn't have that type of alignment? What do you say to them? Because I can only imagine you have the support, but there are days where maybe you're down on some days. Maybe you're getting kicked around, and obviously that happens a lot with an innovation. What's your advice to those folks that maybe don't have the type of backing that you have?
Yeah, I think this is a good question. I think you make a lot of friends. If I can say, LinkedIn is fantastic. So and it's open to everyone. Get to pay a little fee if you want to. I think if you don't pay a fee, I don't want to make up stuff, but you have to go to your networks. Their
Yeah.
networks are there. And so maybe you can't do it with your organization for XYZ, and maybe not all of its, barriers that the organization wants. Maybe they just can't invest in this, and know about an amount of talking can make it happen. Well, you can do it in other areas. There's accelerators. There's other organizations. A lot of organizations have innovation arms now, a lot of larger organizations. So maybe you can't do it with your place right now, but then you go to Northwell, or there's Mayo, and you pitch your idea. And I would say, gosh, you're not talking to enough people if you haven't been rejected, right? At least 50 times.
Yeah. I get the sense that you don't take no for an answer.
I don't. Actually, I really don't. We just keep on going. Just like,
Yeah.
Yeah.
Just keep on going.
Keep
So
on
let's maybe just turn the dial slightly. I mean, in the next 6 months from now, let's just say we're having this conversation 6 months from now, maybe even a year from now, and
Yeah.
we're looking back. What needs to happen in order for you to feel satisfied with the progress of innovation, within your sphere of influence?
Yeah, this is a good question. So I'm a provider, so I do think about, it's important to think about some provider-centric areas along with patient care delivery, because, when your workers are happy, your customers are happy. It is a direct correlation. So some of the things I think about is, when it comes to being a provider, there is so much information coming at me. There is so much for me to keep on top of, and I'm a specialist. And it's way too much. So, and it's at the point now that providers are very interested in using tools to help them give care that's free of bias, help them give care that is not only standard of care, it's exemplary, and it's what the patient needs. So, and actually, I'm really excited by the Mayo collaboration with Google. Hopefully we will get there. But what we need are delivery systems that help the provider do the day-to-day. And when I say provider, I mean provider team, the MA, the nurse, everybody, the team, give the medicine, the precision medicine that is needed. Because right now, it's difficult. If it's just the provider's brain, I mean, all of us know, things fall out of our head. So I think that's one aspect that helps provider and patient. Another thing I think we need to target is the burnout situation is real. Providers are, it's do no harm. We're like the conscientious observers, all of a sudden we got drafted and we're in the military. And many of us are just like, whoa, this is not what we signed up for. It's a different type of phenotype, I don't know, everything, different makeup that wants to do military, wants to be a soldier.
Yeah.
And I think we have to acknowledge that, because more and more is put on the healthcare team's shoulders. And it's such that I think I saw a comic. It's a nurse, and she's holding, it happened to be she's holding a mountain, and she's trying to balance it. And then there was a little crack in the sidewalk and she fell, and she's like, I'm done. And the organization's just like, you need resilience. And so we have to be, I don't know what the solution is. I don't know if it's sabbaticals. I don't even know if it's just acknowledgement. I don't know if it's robots. I don't know. But we have to work on that, because we will lose our healthcare force. We will lose the providers. We'll lose the team, and it's already happening.
My good friend Dr. Ed Shin did actually a similar webcast with Dr. Wendy Dean about moral injury. I'll have to send it to you, and then I'll include that in here. This is actually really, really
Yes.
enlightening, because you're right. I mean, it's a massive problem, which also means it's a big opportunity. And you alluded to this earlier, talking about lots of data and information being thrown at you. I think there is an element of simplicity that is embodied within innovation. When you want to make something happen, inherently, when it becomes more complex, it becomes harder and harder to execute on. Can you talk a little bit about the simple things that you think are executable, that your partners, folks can really take to heart in this next sprint?
God, I mean, yes, I think interoperability. Come on, everybody. Let's just get it done. I mean, we're talking about seeing the data. Well, let's see it. Let's
Yeah.
see it on our phones. Let's see it, let's see it when I'm seeing a healthcare provider. Let's see it when I'm seeing, if I choose to go to Maven or somebody else, let's see it there too. Let's really share that data, because when we're able to share that data, care is better. So to me, it's like one of the simplest, but yet it's so hard because we create some of our own barriers. Even now we have a law, right? The Cures Act. I thought it would cure everything, but like we're working on it. So I think, gosh, to me, that's the biggest hurdle. That's the biggest one.
Yeah. Well, I mean, we're kind of wrapping up here, but I just want to maybe just say, well, for folks that are listening to this, I mean, this is raw, this is real, and as a provider, I'm just wanted to say, thanks for actually sharing what's really going on. And I think a lot of the times, in order to actually solve a problem, you got to get down to the truth. Sometimes people aren't really willing to hear the truth, or maybe they're scared to sort of share what the truth is. I think in your case, you know who you are, you know what you're about, and you're not willing to kind of compromise that. So thank you for doing that. One of the last question that I just want to ask is, if there's one thing that's actionable, because look, we're a community of action takers. In order for innovation to occur, you actually have to take precise action. If there's one thing or one take that you want the audience members to take from this, and again, we've got folks pretty much tuning in globally here, whether they're on the payer side or on the innovation side within the provider side, or maybe we've got folks that are entrepreneurs themselves. If there's one universal take that you would say someone can take action on, what would that be?
Sure. I would say, like you said, simplification, removing barriers, including administrative hurdles. So when we think about Toyota, lean and all these things, and we can debate back and forth all day long about whether it's appropriate for healthcare or not. But you know what? There's some aspects that we need to simplify. Like there's too much. And so I think if that can be, and it can be done in any innovation. If someone brings in something new, it needs to be simple. So to me, I think that's probably the biggest take home. Yeah.
Awesome. Keep it simple, folks. So for those of you that are joining us, thank you. And if you found this content helpful for you, would you mind sharing it on social media? Would you mind commenting on it, liking it, whatever that might be? I'm very grateful when folks are commenting, when they are engaging, because it makes a difference. And the more people that we can bring into this community to advance healthcare forward, it just means that we're going to have more doers in the community. And healthcare is not an individual sport. This is a team sport. It's going to take a lot of people that are working together cohesively. So Dr. Thompson, I just want to say thank you for just being you, for doing what you do every single day, for making sacrifices, for making commitments, for being able to stand in the face of a lot of no's, and yet continuing to persevere and push on. And I'm looking forward to our next conversation.
Thank you.